My guest today is Jenn Coffey. She's from Manchester, New Hampshire, and at one time she was an EMT just like me, held down multiple jobs simultaneously, one of which was a state representative from New Hampshire. She was a Republican and the vice chair of Commerce and Consumer Affairs, and for 20 years she served as a medical tech in the hospital and an EMT in the street. All of that changed when she was diagnosed with breast cancer at the young age of 42, and in 1 year had 3 surgeries and lost everything: her career, her home, and everything. She was bedbound for over 2 years. She developed small fiber neuropathy and CRPS, known as complex regional pain syndrome, another thing that she and I both had in common. The most painful disease known to modern medicine is also known as the suicide disease. Living on a disability, she was unable to afford treatments, and then the denials from Medicare Advantage came. She was forced to sell all of her possessions to try to receive care that she was forced to ration. She had to take her struggles public in order to access care, and it wasn't an easy choice for her to put her life out there for all of the world to see, but her last hope was that continuing her treatments on a desperate act was to live. Welcome to our show, Jenn, and know that I am in this fight with you, and you and I both know this fight very well.
I wish we didn't have that in common, you know?
I know.
I wish we met in a truck.
We would have been great partners in the streets together.
Oh my God, that would have been so crazy to have you for a partner. I would have loved it. I would have totally have loved that. I miss it all the time. Every time I see somebody in uniform, you know, it's like,
yep.
Oh,
I had one of my favorite partners was Donna. Donna was a partner of mine in Queens and the Bronx, and we were known as the Bodacious Buff Babes.
That's awesome. I love that.
It was.
We
did. We started working in Brooklyn together. So
and now
tell
here
us
we
a
are,
little bit
both of
about
us.
So tell us a little bit about your fight. Tell us what's been going on. And you're a healthcare advocate, and you're a pretty strong one at that.
It's more of a battle these days, I think, than it was before. For me personally, it's basically become a brick wall at this point. In the past, I've had help from my senator and from the Center of Medicare Services, who oversees all Medicare products. So, of course, that includes Medicare Advantage products. And United Healthcare just loves to deny and delay care, as many of us unfortunately know from personal experience. And as you said, yeah, I was bedbound for over 2 years, but what got me out of that bed was ketamine infusions. And that's also what stopped me having to take Oxy and Valium and be on a fentanyl patch. And I basically laid in a bed for over 2 years wanting to die because I had no life. And I was in agony. The pain meds just snow your head. They don't actually make it stop.
Right.
Unlike the infusions, which we work on the receptors in the body that shut them down. So it actually, think of it like a fire, right? Put the water on the fire, it sizzles it down. Well, one of the common symptoms with CRPS and something that I experience is a burning sensation that's literally like being on fire. I mean, at its worst, it's like being on fire while you're walking around with barbed wire around you through a briar patch on broken glass barefooted, and you're going to come close to understanding what it is that I feel. It was landing me in the hospital all the time. I had no life. The infusions gave me that back, took those meds away. But the infusions are expensive, and hundreds and hundreds of dollars for every infusion. And I was paying for it out of pocket because, of course, insurance wouldn't cover it. And I was doing all right until my rent went up $400, and the money had to come from somewhere. So I started rationing the infusions, and that was getting really hard. I was not doing well, and I was getting to a point where I was housebound again and couldn't go out. So I heard about the Care of a Cost campaign that People's Action does through Rights and Democracy New Hampshire, my local org. And they were looking for people who were willing to go public to fight for, to show the world, to show the nation, to show the leadership what's happening to people on the ground when they need the care, when the care provider becomes the patient. And they took my story, and we did videos, we did a petition, we wrote a letter to then CEO Andrew Witte, who made $25 million in 1 year. 1 year. Every year that man made over $20 million for a very long time. And that's really disheartening when you think about hundreds of dollars for my infusion and they're saying no. They were happier with me on cheap drugs that kept me drugged up and laying in a bed and not costing them money. Now I want treatment. I want to actually get out of bed and have a life. So we had to fight them. We had to embarrass them to get them to finally agree. And I had to talk to the senators, and CMS fought for me. And they finally issued a letter saying that, yes, it is in fact medically necessary for you to have these infusions to treat complex regional pain syndrome and small fiber neuropathy. And for just about 2 years, they did cover, but I had to fight for every prior authorization, for every it was always an argument. And then sometimes I get the prior authorization, right? But then they won't pay the bill. There was one infusion, they paid $1.22. So of course I appealed that because I'm on the hook for anything under the $600 that I have to pay out of pocket. And I'm lucky. I'm grandfathered into my clinic. It currently costs $950 per infusion. And that's not unreasonable when you consider you're being infused for 4 hours, you're under sedation, you have heart monitors, oxygen monitors, the staff to do all of that. It's not necessarily cheap to keep those lights on. Right. So it's not an unreasonable cost, right? But United Healthcare is like, $1.10, that's all you're worth. So of course I had to appeal it, and I appealed it, and then they decided that on appeal, oh, excuse me, it was $1.22 they paid. On appeal, they decided to drop it to $1.10. They decided they paid 11 cents too much. So I had to go back to my senator, back to CMS, and make another public spectacle and argue with them in order to get them to actually pay the frickin' bill. And it was then that they paid $833, which is a very reasonable amount of money to pay my doctor. Still less than what other people pay, but reasonable. And they've never paid that again. It's been an argument to get they nickel and dime on everything. They constantly say that there's no reason to cover cardiac monitoring, though I am under sedation. Not understanding how that's logical. Yeah. Right? No monitor. You don't need to be monitored. We're just going to put you on.
When you said before that you thought that they wanted you dead, I think after hearing you say that, I think you're right.
Well, now what they're doing to me now is they've now decided that though my diseases are not cured, and they actually have gotten worse, not better, I am no longer covered. They told me that they called me and told me, they didn't put it in writing, they called and told me, and they've refused to give me a prior authorization. So I have no approved infusions. They will not cover it. They say it's no longer medically necessary, filed. And then they also tell me that I need to go to a different provider because my provider is out of network with them. I went to my senator, filed another complaint with CMS, and they said, why don't you try another insurance? I'm like, are you kidding me? Like, that's even an option right now, right? And then they're like,
told you to find another insurance plan?
Yes. The Center for Medicare Services that's supposed to enforce the laws said, why don't you try some other insurance? And they also told me that this was my fault because I am making a preference to see a doctor who's out of network. Even though I have told them in so many different ways, including the last thing I said to them was a giant sentence in almost all caps. This is not a preference. You are asking me to give up care because not one of those doctors that you're offering me offers infusions. Not one. None of them do it. Not a one. So I have to give up care.
We had a retiree that was a 9/11 responder who, I may get some of the details wrong, but the fact is generally the same. He said to me that he needed a specific doctor. It was like, I'll just say like a mental health doctor, for example. And then they gave him a list of doctors who he could see in the network. And one was a podiatrist. Like the doctor didn't even have the specialty and training to provide the care that this person saw. So you're telling me that they were trying to tell you to change doctors and there were no doctors that did this specific treatment.
And then they're blaming me for my choice and telling me it's my choice to go to an out-of-network provider. No, it's my choice to not give up access to care. I pay out of it cash for it. If I need an infusion, I pay cash. I have 3 medications I pay cash for because they won't pay for it because they say they're not medically necessary. Or one that they'll say, oh, sure, we'll pay for it, but your copay's over $80. So I go to Cost Plus, Mark Cuban's thing, and I get it for $30 with shipping. Because my insurance company at United Healthcare chastised me. They were like, when you buy from other places or use GoodRx, you want me to pay over $80 a month for this prescription. I'm doing a mail away to get 30 with somebody else. I have so many pharmacies. It's not okay. No one pharmacist has my chart. Nobody knows me completely anymore because that's what it requires in order to get the price as low as I possibly can. Because I am no stranger to spending hundreds, thousands of dollars to stay alive at this point. When I first started, it killed me. How can I spend this much money on a med? But what's the choice? Die? They'd rather I die. United Healthcare would rather I die because then I will cost them less money, right? Then they're not paying for as many doctor's visits. They're not paying for other medications because they do have to pay for those things. They don't get out of everything. But as far as the doctor things going and what happened to the person in New York City, the law says that the company is required to have an adequate network, not one provider, an adequate network. So when they don't even have a single solitary provider to offer you, you would think that the Senator for Medicare Services would look at them and go, hey, the law says, and we're going to enforce the law. The law says you have to have it, and if you don't, you have to cover at the in-network rate. That's what the law says. And that law person told me to try another insurance or to go to a doctor who doesn't do my treatment. Maybe it's better for them if I go back on Oxy and Valium and fentanyl patches and I have no life and I lay in a bed and I have to wear the Delta pens because I can't even hold my own batter anymore. I want to have a life worth living. Is that so sad to ask for? I thought I did everything right in my life. I volunteered. I did so much work on the volunteering. I can't even tell you. I did everything that I thought the right way. Bought a house, saved money, and in the end, I've lost it all, and now I'm fighting just to stay alive every freaking day, just to stay alive.
Let me ask you a question. You said you had taken this fight publicly as I guess like a way to shame United Healthcare into providing you or approving the treatment that your doctor wanted you to have, that even Medicare affirmed that was medically necessary for what you were being treated for. And yet you had to make this fight very public. Yeah. Tell me about that move, because that had to be very difficult to share something so private.
It really was more difficult than I think most people understand, and I don't even know if I've said this publicly before, but I was in a really not so great place. And my life, when the cancer happened, was horrible. I was married to a man who had climbed into a bottle and forgot he had a family, and he was horrible. And almost every single night he would tell me to hurry up and die. And it was really hard to take.
I'm so sorry.
I spent so much time. I spent years I destroyed a lot of relationships because I tried to hide from everything. I had a public life. I did my volunteering. I just wanted to live out the rest of my days, however they may be, in peace. And I really had to make a decision on whether I really wanted to die or not, right? Because if I really didn't want to die, I was going to have to fight for this because the money was just not there. I mean, $400 was so much money to come up with all at once. I didn't know what else to do. And I was having infusions every 4 to 6 weeks at that time. So I just stopped.
And the pain, the tremendous pains. Mm-hmm.
I can't even explain to you how torturous it is and how much your brain doesn't function correctly when you are so locked in pain that and it doesn't go away. Think about this, all right? When people get tortured, the person doing the torture is going to stop. They're going to sleep. They're going to go to the bathroom. They're going to eat. They're going to stop hurting you at some point to take a break for themselves. CRPS never does that. It doesn't matter 24 hours a day, 7 days a week, the middle of the night. In your sleep, you will feel it. I do not get sleep like other people do, despite the medications they give me to sleep, because my body feels it. despite whether or not I am alert to it or not. And the disease does more than just cause pain. And pain just seems like such a small world to use for something that literally feels all-consuming, that literally disrupts every aspect of your being. It's impossible to think a straight thought when you're in absolute agony rolling around in a bed and nothing works. I mean, they've given me some heavy-duty drugs to the point where they almost killed me once. All of a sudden, my heart rate dumped, and the last thing I heard was my son screaming for help. That was the last thing I heard. And I woke up being hypoxic and fighting with them trying to keep oxygen on me, because they had over medicated me and dumped it, and I still felt the pain. They threatened me with putting me in a nursing home if I wouldn't accept being on opioids, narcotics, and fentanyl. And that was the alternative. And I will never let anybody put me there again, not United Health, not anybody else. I will never go back on those drugs, ever. I will fight to my very last breath, and I will pay every dime that I can to keep my health to a point where I can have a life worth living. And when the day comes that I can't do that anymore, then we will have a different discussion.
You've been through a lot. And I feel some of your pain as I've been down some of those roads with you, especially dealing with CRPS, with breast cancer. It's the things that you've had in your life are tremendous. You, like me, are a person that takes care of other people, and we struggle sometimes to take care of our own selves. I'm very glad that you are here with us today and that you chose to fight this, not only for yourself, but for publicly, because you've become a warrior on this scene and in advocating for healthcare, not just for your own self, but for other people that are being denied healthcare access and treatments, not just from United Healthcare, but from all vendors in the country. And that is, I give that tribute to you, because you've been wonderful in working besides in this fight. You and I met back in 23 when we were down in DC with Be a Hero, national organization, Audie Barkin's Be a Hero, and Social Security Works with Alex Lawson. And we traveled the halls of Congress together, and I was so very grateful to meet you that day. And I'm glad that you are doing better and that you're here, and you've taken this fight nationally. You even did a rally in the city where you were you dressed up like the CEO. We have a few minutes left, so tell us a little bit about that.
Yes, we went to New York. We went to the New York Stock Exchange because United Healthcare was releasing their record profits yet again, which average around $8 billion every 3 months. And we wanted to make sure that the public knew what they spend that on, because they have 2 Gulfstream jets, for example, because they're not going to fly in a plane with us, the peasants. They can only fly privately. These people are raising our premiums. They've taken away dental care. Like, they used to cover fillings now. Now they don't cover fillings anymore. Now you can only have x-rays and a cleaning, and that's all it covers, and only up to $750, and only for those things. And yet they raise the premiums again, and they're going to raise the premiums again next year. This is the worst fleecing of Americans that have ever happened. And it's the greatest racket in the country, because they're making hand over fist money on the backs of the dead, the dying, and those that are being denied health care. So like you, I guess, and selfishly, a part of me gets a little bit to still be an EMT as long as I'm in this fight. And I'm going to keep going back and forth to DC and rattling the halls of the legislature and trying to fight for health care for everybody. We all deserve it. We're all human beings. But if you want to know what I do more, visit me at JennCoffey.com, JennCoffey.com. My email's there. Go to the contact page. You can email me directly. I got a basic Gmail account, JennCoffey16@gmail.com. I want to hear from you. I want to hear your stories. I want to help you fight for the care that you and your loved ones need. Nobody deserves to be denied the care that you and I help pay for, by the way. Our tax dollars have developed many of these medications and treatments. They fund your local hospitals. You have a right to all of that. These are not give-outs. These are not handouts. These are the insurance policies that you and I paid into our entire working life, and we are deserved of those things. These are benefits we paid into, not handouts. So anybody that tries to feed you that line of malarkey, shut them right down. It's one of my biggest
pet peeves. Your accent comes out more, Jen.
I get, that's one of my biggest pet peeves is when they try and say Social Security disability insurance is a handout. It's insurance, it's a handout. Social Security itself is a handout. Or
You
Medicare.
paid for it.
None of these things are handouts. They are all things that you and I have paid for since the day we got our first paycheck. The first paycheck I ever got, the taxes came out of, I was 15. Not that I didn't work before then, but my whole life I paid into that. I have a right to that money. I have a right to the insurance I paid into, and every single one of us do. And by the way, that's how insurance works. So if anybody tells you, I don't want to pay for anybody else's care, that's another line of magalaki, because you are if you pay for insurance. That's how insurance works. It's a pool. Everybody pays into the pool, and the pool is supposed to pay the bills. But what they do is divert that pool, including our Medicare trust fund dollars, into their own grubby pockets. Because, making $1 million, $2 million, $20 million, that's not enough money for them in profit. These people make United Healthcare alone, fourth largest company in the United States, most profitable nationwide, not just healthcare. $8 billion every 3 months they make in profit, and they still cry poor mouth, and they still demand more of your tax dollars. And it's not going to stop unless you stand up with me and with you, Marianne, because that's the only thing that we can do to fight back. Because let me tell you, they got $1 million lobbyists up on the hill, so you've got to send us up there to fight back.
And yet still, while they're making those record billion-dollar profits, they're still denying your care and denying your prior authorization, and they're cutting back, like you talked about, those extra perk plans that they advertise in the Medicare Advantage plans, restricting your dental care and vision care and, I don't know, probably reducing your debit cards.
What debit card? There's no debit card. Not here. Not here. There's no debit card here. Not in this state. Not New Hampshire. We barely get coverage. We barely have coverage. The co-pays are insane. It's $75 co-pay to see a specialist out of network.
Oh my goodness.
Yeah, that's what I'm fighting against every time I try and see my doctor or have a treatment. Co-insurances, 50%. It's insane.
On your Medicare Advantage plan?
That's what I'm fighting with. Because they refuse to cover them in network. Because I should go see one of their people and give up treatment. And just go back on the drugs, man. You were cheaper then. I swear. United Healthcare keeps trying to kill me off, and they're not going to succeed because I'll be damned to let them win.
You keep fighting, Jenn.
You too. Keep doing this. I'm so proud of you, and I'm so thankful for you doing this because we need it. We all need it. Thank you for all you do.
Amen, sister. And if anyone who wants to get in touch with Jenn, remember it's JennCoffey.com, JennCoffey.com. You can read about her story there and contact her. And if you're having trouble securing your health care or being needing some help fighting your denials, reach out to her for some guidance and advice. She's a true warrior. Thank you, Jenn. It was great talking to you today. I look forward to talking to you again. And I agree. I will be coming to DC the next time you go if I can. I'll bring my retirees with you. So you have a great day. Thank you for joining us and sharing us a very personal story with our listeners. And we will be right back after this brief break with Joe Maniscalco. Thank you.